attend can do that. And that's just indicating that we are recording it. I think probably everybody's got used to the functions now, but this is just a slide that sort of describes those functions. It's just easier if people can put themselves on mute if they're not talking. We just don't get that background interference and everybody can hear. The function that you can switch your video on and off. Chat function, so do feel free to put any comments etc. In the chat function, but equally, you know, just pop your hand up as well if you want to come in. And then for those of you who've got used to the sort of the reactions as to whether it's a thumbs up or thumbs down, please also use that, as well as the sort of raise hand functions through those reactions. So that's just that explanation. If there are any just queries as we go through, then don't hesitate. So I'll ask just my team, but I think you'll probably know them all. So those of you who don't know me, I'm Sue Venables. I head up the involvement and communications team at the moment for the 3 clinical commissioning groups, soon to become this thing called the integrated care system. I'll just ask Joe and Burj and Jit if you just want to say hi.
Yes, hi everybody, I'm Jo Ryder. I do know many of you. I'm Experience and Relationships Manager. So I work with Sue in the team and I manage the team as well. Thank you.
Burj.
Hi everyone, I'm Ppg Network, the Insights and Experience Officer for the 3 CCGs.
Jit.
Hi, I'm Jit Parrick, Engagement and Community Officer, and I work with the whole engagement team.
And not least but last, Helen Cullinan. Welcome, Helen.
Thank you, the one and only. Hi, I'm Helen Cullinan, and I have the same role as Jit, so working out in the community with patients and also our voluntary and community organisations.
Lovely, thank you for that. So I'll push on quickly. We've got Burj who'll be doing a session. As you know, we did a bit of a questionnaire with you all before Christmas and just after Christmas. We've got the feedback on that. We think you'll be kind of really interested to know what's happening across Leicestershire and Rutland, and which PPGs we heard from, and how everybody's feeling at the moment. So Burj will be doing that. I'll just be coming in about a bit more of a detailed discussion around the primary care engagement framework going forward and how we support PPGs, PCNs, and then this network. So we'll have a bit of a discussion around that. Then Joe's going to give you the COVID-19 update, particularly some really low-level neighbourhoods work now that we're doing at grassroots levels, and then we'll go to any other business. So straight to you, Burj.
Thank you, Sue. Morning, everyone. So I introduced myself here, but I'm Ppg Network, the Insights and Experience Officer for the 3 CCGs. So you may have seen my name via email quite a bit, just giving PPG updates, but I also do a lot of background stuff with making these meetings happen, getting the right speakers, etc., etc. But today I've been out of the cage, so I'm in the public eye, so I will be on my best behaviour. So the PPG network, I guess, since the pandemic began, we felt that we needed a survey just now to sort of understand where we are with PPGs. The pandemic, I guess, restricted us in many ways, especially the ways we interact, which meant that a lot of PPGs lost communication with their GP practice and fellow PPG members. So the survey was then created to help us identify what's happening with PPGs, basically, which are active, which aren't, which ones we don't hear from. And that gives us a kind of an indication of what work we need to do to try and sort of understand what's going on really with PPGs and how they currently sit. So with this survey as well, we obviously want to get as many members on our distribution list that are aware of everything and anything that's happening with PPGs. We'd also want to hear from sort of your own opinions of what you'd like to see on at each network meeting. And we also wanted to hear from you from all the sort of hard work that you've been doing over the last year, and to share those across the network. So what I'll do now, I'm just going to go through the sort of responses we got from the actual audit or the survey. So it ran just before Christmas, from 22nd of December until yesterday, basically. Now, the way the survey worked, you had an option of 176 GP practice sites across LLR, and that included the main sites as well as branch sites. So from that, we received a total of 64 responses or individual responses across 53 PPGs. And as you can see from the pie chart, it was split by the following locality. So we had 58% of responses from practices in West Leicestershire, 22% of responses from East Leicestershire and Rutland. And then we also had 20% of responses from Leicester City practices. This next slide basically tells us the percentage of PPGs actually active from the responses we had. So 61% said yes, their PPG is active, 36% no, they're not, and 3% said they were unsure or didn't know what the current status of their PPG. So the table on the right there shows the responses by locality. So as you can see again in the city, 6 respondents said yes, their PPG is active, 7 said no. In West Leicestershire, 24 respondents rather said yes, they were active, and 11 respondents said no, and 2 said they didn't know. And in East Leicestershire and Rutland, 9 people said yes, their PPG was active, and 5 people said no. So the practices that we didn't hear back from, so from a total of 176 GP sites, again, remembering this is main sites and branch sites, 123 sites didn't provide a response. The table below depicts how that was broken down by locality. So again, Leicester City CCG, we didn't hear back from 58 practices, that's 47%. From West Leicestershire, it was 34 responses, or 34 practices we didn't hear back from, that's 28%. And East Leicestershire and Rutland, we had 31 GPs that we didn't hear back from, and that's 25%. With a focus on working as PCNs, we just wanted to find out just some of the basics of what people understood. So 96% of respondents were aware of which PCN they fell under, and 4% didn't. But whereas 33% of respondents said they were involved with patient meetings with their PCN, 60% of respondents said they weren't. So it feels like we need to do quite a bit of work around that for sure. So this next slide is all about you guys, really. I won't go read each one out loud, but this is basically all the hard work and commitment you've shown under very difficult and challenging circumstances over the last year and probably beyond that. I think it's important that some of the stuff you've done here and been quite creative, for example, creating Facebook pages, using the Nextdoor app, and some of the stuff you've really had to do at ground level, like help deliver medications to patients in lockdown. This is just testament of what you've really been doing, and absolute credit to you all for really stepping up when it's mattered. And I'm hoping just reading some of this stuff, you could think maybe I could apply that to my PPG if you already haven't. So this is really just about what you guys have done in sort of for the PPG network, not just within your own, but as a whole network, and how you've been supporting it. So one of the things that the survey also asks is what you'd like to hear about in PPG meetings. So again, I'm not going to read every single one, but again, you know, there's a lot on here. Some about the ICS, some more sort of focus on healthcare topics such as diabetes, mental health, long COVID. There's something about pain management, healthy eating, ambulance waiting times. There's a lot on there. So this is great because it gives us a lot of ideas of what you guys are after in the network meetings. And it also allows us now to go back and speak to the right people and see what we can actually get speakers wise and information wise of what some of these might cover. So so again, you know, thank you for all your sort of ideas and what you're looking for from the network meetings. So from all that information, we just had a look at what we can do for next steps. And the key ones are here. That's identifying GP practices that don't have a PPG currently. And if GPs of branch sites themselves have a PPG for each branch, whether it's the main and the branch. We'll also be looking to collaborate with you guys because you could provide further information within your PPGs at PCN level, because you might just know stuff which might help us identify which PPGs aren't active. So I mentioned before, taking action and feedback received from you guys to how to structure future PPG meetings and discuss what you guys really want to hear about. Also, we need to identify key contacts for each PPG and then work closely with the PCNs to establish a framework for future engagement. So I'll stop there and, you know, open the floor to you all to see if you've got any questions or any sort of observations you'd like to sort of suggest. I've got Alan.
Thanks a lot. One of the things that was raised at the last meeting was the integration of social services into these meetings and having an input from those. Has any progress been made at that level to look at getting somebody from social services as part of the ICS to improve our knowledge of what's going on there?
So not currently, Alan. I think what we just need to, or what we feel we need to do, is we need to start to look at our current structure as it stands. I mean, it would be fine, we can invite a guest speaker along to these meetings, we can do that easily, but I suppose what our key focus really on is strengthening the network, getting it back to where it was 2.5, 3 years ago and embedding it in with the primary care networks. So I suppose that is our key focus. So we in terms of understanding what's going on in social care, particularly with additional funding that's currently going into social care, happy to invite, you know, somebody along to these meetings. But I think the true embedding in, for me, has to come when we've tightened up our own structure. And I think that's where we're really looking for your support on. And that seems to be also, you know, what's coming through the report, the findings that Burj has just gone through.
Okay, thank you.
So I think next up is Susan. You're on mute, Susan.
You were saying about finding out who's in charge of the PPGs. Would it not be a very good idea for you to devise a list so that you know who's the chair of each PPG and their contact details?
And that was part of the survey, but again, a lot of responses I just mentioned their sort of name, but not their position in the PPG. So yeah, absolutely, we could send a request out to you guys, and if you do know that, yeah, happy for you to email that back to us.
I think also, Susan, it's we don't know what we don't know. So we've got a robust list of people like yourselves, yeah, who we know are very proactive in a strong PPG. But I think over the last two years, we have lost contact over time with a number of PPGs. Now, what we don't know is whether those PPGs are just, they're still active, but we haven't made those connections and those relationships with the chairs or the practice managers. So we need to do that piece of work. But the other aspect of it is we don't know if the fact is that they don't exist as a PPG anymore. And for me, that is where our role comes in, because we need to work with that practice to build that capacity back up. So I think that's the kind of difference with it, Susan. But I think the request that Burge was making is any ground level intelligence that you guys have got, which we know you will have, to help us get to that position would be fantastic.
Right. And I've forgotten what the other thing was. If it comes to me, I'll get back to you.
Lovely. Thanks, Susan.
It's John next.
Thank you. Just one point, the first point I would make is that for those of you that knew Margaret Taylor, who usually appears at these events, I have to tell you that she died over the Christmas period. So I don't know how many of you knew her.
Thanks for that, John. I think at the end I was just going to do a bit of a tribute to Margaret and cover a little bit of what she was doing. But thank you for bringing it up, John.
Okay.
Appreciate that.
One of the points in Virgil's presentation was something, one of the small boxes that referred to reception training. Are you able to give us a bit more information about what that implies and what's being actually done?
So the surveys kind of disclose, obviously I can't share who it was that said that, but it was more a case along the lines of just speaking to receptionists and help them how to maybe speak to certain patients in certain ways. I think obviously through a tough time for receptionists with the pandemic, things might have got quite stressful. I think one of the PPGs took it upon themselves to kind of help support them with that and how to talk to certain patients in, so for example, if it's a language barrier or something like that. It was just helping them out really, just to ensure that the patient does to get the right level of service and treatment.
Yep. Because the nature of the receptionist role has changed to such a degree that there is clearly a need for people to be brought up to speed without them getting a message that they're being criticised, because it has changed and it's become more difficult. So that's an important thing as far as I'm concerned. The other thing was you were talking about having having an awareness of what's actually going on. Is there any value in any of our communications being copied into you? You know, not the routine stuff, but other stuff, just so that you are aware of what other PPGs are doing. And we've had a big promotional drive here, and we've now got to the stage where we've had to set up a secondary team just as associates, because we've done so well accumulating members.
I think that's a really interesting idea, John, because I mean, we call this a network, but in effect, it's just a network meeting.
It's not a network, right? But
you're suggesting creating more of a network and interacting with your counterparts. Now we could set that, I mean, it could just be maybe a WhatsApp group, or it could be a Facebook group that we set up so that you can all interact with one another. So I think that's a really interesting idea, and something that if you all felt, well, I think that would be great. Let's make it a proper network, not only the meetings, but interaction with us outside. We can facilitate that, John, because I think that sounds like a good idea. Don't know how other people think.
It would certainly make life easier. It would save you having to send so many surveys out, because you might already know the answers.
Yeah, like it, John, like it if other people do.
Yeah, I think, sorry, my view on that is, I mean, one of the things about networks is sharing ideas and to see if that idea would work well for your PPG. So I think that's, you know, got a real legs on that. So absolutely, John, seems like a good idea. I guess we've just got to think of the right sort of, like Sue mentioned, whether it's a Facebook group or a WhatsApp group, the right sort of platform that's accessible for everyone and simple to use as well. I hope I pronounce this right. Is it Tad Doy? Sorry.
Tadeusz, Tad for short.
Hi, Tad.
Remember
Hi.
Tad. I've got two questions. One is, I like the statistics, but I'd like to know what the basis is. So I want to know how many PPGs there are in Leicestershire. In fact, how many practices are there in the various areas in Leicestershire? Because I think that's a bit of a comparison. We get figures which are mean nothing at all until they're compared to some sort of basis. And secondly, if I can ask you, Richard, to send us copies of the slides that you produced. They're quite useful. We can then present them at our local PPG or PR, as in our case, PRG meetings, and we can demonstrate what's going on. It's very useful to have this interface to talk to other people who are doing similar sort of work and have the same sort of problems. And I think this is a very good medium to get together. And I think the medium of these meetings is quite useful because you can expand it quite large. You know, and we've got 33 participants. I participated in meetings with over 170 people, and everybody gets to say their little bit if they have something to say. Okay, that's just my points. Thank you.
That's really great. Thanks for that, Tad. And you're right. I think we have outlined the number of practices there, but I think it's one of our problems at the moment. We don't know exactly how many PPGs are out there, and that's what this survey was partly to do. But clearly now we need to do a lot of embedding in talking with individual practices to understand what is going on, because we're making the assumption that if we haven't had a response from certain PPGs, that their practice hasn't got a PPG. But it's like I said earlier, we don't know what we don't know.
Thank you, Sue. Got Alan next.
Hi, folks. One major point, Sue and everyone else, is the contract with GP practices has changed. So, number one, GP practices do not have to have a PPG anymore, whereas they used to. I'm sure I'm right in that. Secondly, Virgil's right. You need to know from, me and other locality chairs, which of our practices have and haven't got a PPG. So, for instance, in Northwest Leicestershire, 50% of the practices haven't got a PPG. And unfortunately, at least 2 of those are the biggest practices in Northwest Leicestershire. So it's a big issue. And I don't know how you go from here to there, Sue, but somebody needs to talk to the practice managers as well to find out why they haven't got a PPG, when they had a PPG.
Yeah, you're absolutely right, Alan. So yeah, we did used to have the contractual teeth, but that went a little while ago. However, for me, there are still 2 key things. We've obviously got the contract that the CCG, as it stands at the moment, has with the practice, and those discussions have to involve patient engagement. So they have to be able to demonstrate patient engagement, and the best way is with their PPG. The other lever that we have is with the Care Quality Commission, because the Care Quality Commission go in regularly to obviously inspect those practices. And one of the key aspects that they look at is what is the interaction in terms of the engagement outside of the main consultation. And again, they would report on that if the practice hasn't got a PPG. So whilst we haven't got any longer those contractual levers, there are other levers. But I think we need to be talking as an integrated care system about, how we balance. It's the carrot and the stick, isn't it?
Yeah.
So yes, and once we know who has not got a PPG, that's where we need to have those serious discussions.
So from my point of view, Virgil, I'll send you a list of who has and who hasn't for Northwest.
Brilliant. It'll be very helpful, Alan. Thank you. Howard.
Yeah, hi. Going back to a couple of John Wood's comments, mentioned about some sort of networking. Just like to mention, if you're not aware, there is a PPG forum, which is chaired by Harsha and Kash's secretary. I'm also a member. It's primarily was for city PPGs to get together once a month to discuss problems they've got. The PPGs can learn from each other, and we used to have the chair and the secretaries in attendance. We're now currently looking at expanding it to Leicestershire and maybe Rutland. I don't know if you want to mention, say a bit to it, Cash, if you want. But you know, one of us can give you the details. Joe Ryder certainly has the contact details. Could pass on to you. The other comment was on receptionist training. There's one thing I raised on the survey. Following some complaints we'd had from members, patient members to our PPG, and discussions with the one of the GP partners at practice, and then the supervisor, receptionist supervisor manager. They put in a training program for the receptionists. It's basically to sort of enhance people's skills and how to cope if you've had, say, a difficult patient, or you've had a bad day, whatever, not to let that affect your communication and discussions with the next patient. So I believe that is currently ongoing. So that's all I've got to say on those two matters.
Thank you, Howard. I think we are aware that Harsh, I think, Joe, you've been in discussions with Harsh about that particular forum and how they can help engage within the city anyway. But it seems like a sensible idea to extend it out to the county and Rutland as well. But we are in discussions with Harsha about that, I believe. Is that right, Joe?
Yeah, I was just writing it in the chat box actually. But yeah, so we had some early conversations just before Christmas about because the network does one thing, but we were just saying about, you know, that kind of practical level of support. It might be, you know, Harsha felt it might be a good idea for it to kind of like be peer-to-peer. So that was something that she was interested in, making that offer wider. So yeah, we're going to pick that up in this year. So we just started those conversations just before Christmas.
Joe, Susan, and then John. You're on mute, Susan.
I've just remembered what I was going to ask before.
Yeah.
Is it possible to have a list of the jargon words, as I call them, that are used now? Because things are changing.
Jargon words.
Yeah, you know, I used to come out with ICS or something.
Yeah, so
integrated care system, or ice cream sold on Saturday. I mean, if you don't know what it means, it can mean anything.
No, absolutely agree. Yeah, I mean, the NHS is known for using jargon, but what we try to do in all our communication, if it is ICS, for example, we'll try to detail what it stands for, etc. But yeah, no, we'll continue to do that, and you know, try and correct it if we don't include it. But that is something that we always try to do anyway.
Okay.
My point was simply that we got a circular from NAPP yesterday, and one of the items in it says, is there a contractual agreement regarding CCG support? And is this on? Oh, sorry. Then it says the GP contract refers to the GP surgery that a contractor must establish and maintain a PPG, which includes some of its registered patients, to enable the surgery to obtain and seek feedback from patients about their services. Do I get the impression that the NAPP is behind the curve here?
So yeah, Joe and I just kind of attempted to answer this. So it's much looser than it used to be, and there's no monies attached. So, you know, it used to be it used to be very, very specific, and there used to be a sum of money that went with it. That actually went quite a while ago. So that was just an example. We just have to use other levers in terms of our persuasion of practices to, you know, to see those benefits, and also to see engagement of patients different from the interaction that they have on a day-to-day basis of a consultation with a patient, a medical consultation, because sometimes practices see, well, I am engaging with my patients every day, but that's not engagement as we would kind of view the world in this forum.
Thank you, Sue. Bit mindful of time, so Paul, you can have the final question, then we'll move on to the next item.
Yeah, I really sympathise with you trying to persuade GP practices to have functioning PPGs. Basically, if the GPs don't want a PPG, they will avoid it happening. If they do want it, if they see it as a central part of their operations, they'll make it happen. And that's the top and bottom of it. You have got levers that you could push and pull. Things like in the earlier days, people like Angela Bright did used to coerce GPs into having a PPG. You take a more gentle approach currently, not you personally, across the ICS. I think there is no excuse for not knowing how many PPGs there are. All you've got to do is contact every one of your practice managers and ask them, and make them reply. I mean, either yes, no, and the person who's the chair is so-and-so, and this is their contact details. It's a trivial exercise. Going back to moving on now to the point on acronyms, the easiest way to understand the acronyms is just to Google them and write medical after it. And you will always get more than enough information on whatever acronym you've got. So as long as you've got a mobile phone or a tablet or something, you can always find that out very easily. That's me.
Thank you, Paul, for that. So just, I mean, yeah, because I guess of the pandemic, we have an existing database of PPG members and practice managers. What we felt first is wanted to just sort of check that database if it was still, you know, what's changed and what's not. Next part of this is sort of going out to practices and finding out. But from the survey, we've got a lot of information that we didn't have before. So that would probably possibly save us going out to some practices. But no, I take your point now. But yeah, a big part of this is contacting now the practices and finding out what the status is of their PPG. And secondly, yeah, I mean, I think about the abbreviation thing, you know, some people still don't prefer online methods, but like I said, we'll keep trying to abbreviate where we can on all our communication.
So Burj, I think we've just got one question in the chat box from Karen, because I think she can't put a video on or raise a hand. So she's saying, I saw on the survey results there was a mention on a PPG doing a patient survey. I'd love to know more on how they did it, and anyone online today knows.
Yeah, so one of the PPGs, I think, did a survey within their whole PPG group. I'll have to try and find out who that was, or if someone in this group did do a survey, is happy to share that. But that was some of the data I captured on one of the surveys. I think it was just a feeling of how they're feeling as a PPG generally, but obviously the survey doesn't have too much detail on there, but I can try and find out for you, Karen, and sort of find out who it was, and if they can share that with you.
Okay, lovely. So thanks for that. So we'll just go on to the next item because I'm just conscious of time. So really this follows on quite quite nicely to this discussion. So I'll present really quickly. So obviously we've just been talking around, we've got to get the foundations back, and the foundations in terms of primary care engagement we see very strongly as part of the community and as a key part of the community within your practice. Patient participation groups we see are the strong foundation. So, you know, quite rightly, I think you kind of recognise this. I think from the discussion, you are as keen as us to get as virtual 100% coverage across every single practice across Leicestershire and Rutland, and kind of that's our goal. If we're putting some objectives into this, it's that 100% coverage we are trying to establish, and we're also wanting to get back to where we were in terms of the network and the interaction that we've got. So that foundation is really key. But obviously now we've got this other kid on the block in terms of the primary care networks, and we know that some primary care networks are really storming ahead, and they've already created their own network of patient representatives for their PCN structure. So we want to work with the PCNs to progress that even further, because in terms of understanding things like, you know, the health management of the actual population, to understand, you know, how many people have got diabetes, how many people are suffering from other long-term conditions, you know, are we supporting younger people? We need to understand that, and that is really good at that neighbourhood, at that primary care level. But then we talked a little bit around this in terms of the network linking into this new integrated care system, which we have, you know, touched on in other meetings. What is that going to look like? And, you know, we've had that discussion today. Is it not only this network of people coming together on a meeting, but, you know, do we really need to create a network where you can interact with others? What will that look like? So if we stop sharing now this slide, so it's really, and I'm just kind of conscious on time, but I think this is about a kind of bigger discussion around this. And I'm just wondering whether we maybe come to you and say, is there almost a bit of a task and finish group that we can work with? So a handful of you, 5 or 10 people, maybe we can even get together face to face. Wouldn't that be great? Just as we're coming, just to sort of get to the grips of this and say, what do you want it to look like? We've shared this slide about our, you know, utopia vision for the future, but we want to make sure that it kind of works for you because you're the foundation. So just to put that out there, is that kind of a plan, and is there any volunteers, or do you want to throw in some ideas now? So really kind of open to you on that. So I'm just looking at the chat. Not got any questions of that, but Joe, do you want to come in, and then Brigitte?
Yeah, I just want to say apologies. I know there's been a couple of people that were struggling to read that. So I think we'll adapt it and get it back out so into black text so that you're able to read it. And if you do want to consider that in your own time outside of the meeting, then maybe it would be good to revisit in whatever way people are happy with.
Okay, lovely, thanks. Brigitte?
Just to say, yes, I would be happy to be part of a smaller group, because that's really how you get the work done. And I think if we could meet in person, it would be just fantastic to actually see people, not just the face. Yes, I'd be very happy to do that.
Lovely, thanks for that. So I mean, as a proposal, if it's something that you're interested in being part of, either online or face to face, and I understand that there might be some reticence in terms of face to face, but we can work around that. Just pop your names in the chat box if you're up for this, because there's nothing like a bit of co-design for this to make sure we get it right for everybody. Okay, so I'll go over to Jo now, if I may.
Great, thank you, Sue. So I'd really like to update you on where we are with our vaccination clinics. Now, I'm particularly going to talk about pop-up vaccines. Now, these have just started and it's over the next 3 months. So it's important that you're aware that this is now happening. So this is in response to the insight that we've gathered across Leicestershire and Rutland on people that were maybe hesitant of having the vaccine, or people that were struggling for access. They weren't able to get to certain places for it. So what we're doing is some sort of wraparound support. So these new pop-up clinics are now popping up in Leicestershire and Rutland, and they're very much targeted on areas of where we've got low uptake or high deprivation, or areas where, again, certain communities that are struggling to take part in the vaccine programme. So it's really our local response within the communities to outreach to support this programme. Next slide, please. So it is a 3-month plan, and it's where we're offering primary, secondary and booster doses. So anyone that's not had their first or second dose, there's also a third dose, which is going to vulnerable people. So if people receive a letter, if they come with their paperwork, they can have that there as well. It is Pfizer vaccine now, that's being done on these pop-up clinics and with all of our booster clinics. And we're kind of supporting in 4 different ways. So we have posters and postcard distribution in local venues. We're now doing letter drops to residential houses, targeting those areas where, again, low uptake, and having conversations in communities, but also with voluntary and community support. And that's something that's just starting, and we're really starting to build up. So we're really interested to make you aware of this and see how you can support with that as PPG members. And signposting to the clinics on the days. Now, all these clinics are taking place on the weekends, and they're Fridays, Saturdays and Sundays. And there's one in the city and one in the county now every week. So this is just one method to target local communities. And because they're the style of that they're using 2 vans, they need a lot of space to deliver this vaccine in this way. So we're not able to do anywhere that's not got enough space. So they tend to be in large car parks like Tesco and places like that. But there are other things that we're looking at doing, like a mobile van and other things as well. So this is just one part on top of the existing clinics that we've got in the community. Next slide, please. So I've listed the top areas where we've identified where there is low uptake for the vaccine for lots of different reasons. Some of it might be to do with access of where we've got clinics. Some of it is to do with certainly some areas of deprivation, certain communities, or apathy. There's lots of different reasons why it's low, but this quite broad areas you'll see are the 8 areas in particular. Now, there is one missing off of here. There's also Leicester City. That is also an area that we're looking at as a separate area. Next slide, please. So we've been working with our partners to support this programme, and there's an awful lot of work that goes into setting up these pop-up clinics. It isn't, unfortunately, a case of us just putting everything onto a van and driving there. It actually takes weeks for us to sort out. So just to be clear, it does tend to be, we get confirmation quite late in the day, and so we're trying to do whatever we can to get promotion now sorted out. So we're working with our local council staff and district councils, and that's been really effective. Leicestershire and Rutland Fire Service, they're doing our door-to-door postcard drops for us in low uptake areas. We have got St John Ambulance as well, who are supporting us, British Red Cross, the local health watches, local voluntary and community organisations as well, military personnel, local community leaders, champions, ambassadors. there's so many more, and this is why we're coming to talk to you today, because we'd like to, where we can, work with you as well on top of this. Next slide, please. So what we have done is we've now got postcards available. So the one on the top is the one that we were using, which is very much national campaign. The one at the bottom is the one that we're using now. Now, the one at the bottom has just been signed off as of yesterday. So we've now got that available, and we're able to circulate that to you, should you be able to promote this in any way whatsoever. We also have some posters available as well, and they're also going out into communities. Next slide, please. And this is what it looks like. So this is the first one that was done in Beaumont Leys. And this is what it looks like. It's literally two vans next to each other with awnings. As you can see, it takes up quite a lot of space. Next slide, please. And this shows the layout of the clinic. So you'll see on the left-hand side, people where it says entrance only, they'll walk in and they'll be directed to two different areas around the sides for social distancing purposes, going to the first awning where there's a registration. Then they'll come out of there, go into the second awning and have their vaccination there. So the vaccinations don't actually take place on the bus. That's where all the equipment is. We have to maintain certain temperature of the Pfizer vaccine. And then after they've had the vaccine, they come back out. And there is no 15-minute wait. That's now stopped. It's not required. So people can just go about their business after that. These are walk-in clinics, so that people can book in, but they don't have to. Next slide, please. So what we're doing, as I say, this is a pilot. It's something we've just started to trial. We are asking people that take up the vaccine how they heard about the clinic. And we're having discussions with anyone that's been involved about the success or how they feel that it's gone. Now, this hasn't really, we're not really at the stage where we've got communities going and doing the active promotion. That is actually happening this week and next week. This week we're being heavily supported by the city clinic is being supported by the university because it's located in Victoria Park, and the county one, which is going to be in the marketplace, is being managed by Charnwood Borough Council, so they're doing that one. But going forward, we are getting some staff to support us with this. It's very important for us going forward to really work with the voluntary and community sector, VCS, there's another acronym there, on how we can get messages out in the community, which I'll come on to. But it is an ongoing programme. As I say, we are piloting it to see what we need, and we're at the point now where we feel like we're in a position where we can actively promote. And this is, again, this is where we really like your support going forward. Next slide, please. Oh, we seem to be missing a slide, which I'd added in for some reason. I don't know what. So if you want to stop sharing for now, I'm just going to share my screen because it just shows you where the clinics are. Sorry about the, what's saying recovery. Okay, so this is where we've got our pop-up clinics. Now, I just want to say this looks really last minute, and it is. What we are trying to streamline at the moment is how we can get the information quick enough so that we can actually go out and promote. So we are really mindful that, you know, people in the community need to hear about this as quickly as possible. But it takes a lot to set these clinics up, because even when they get agreed, we have to do a thorough risk assessment that is done by the site. And we have to make sure that we've got somebody that's providing the clinic itself. So we're using pharmacies and other practices and people like that. There's a lot that goes into this. And so that's the part that we're streamlining now. And we're getting to a position where we're hoping we can find out in advance enough so that we can let people know. So we're really mindful it's quick at this point. But what you'll see on the bottom locations, they're next week, and that's the quickest we've had things. So we're kind of pushing forward now to try and say, look, we need this as quickly as possible so we can let you know. So you'll see the bottom two is for next week. We've just had confirmation on these, so we're actively promoting now, or getting ready to promote. So if you're able to help in any way to really push forward on any of these, we'd love to hear from you, and we can make sure you've got bits and pieces that you can promote for us. The one at the bottom is a city venue. It is actually an Eastern European supermarket. So where we've got anywhere that's very targeted around certain communities, this is where we're working closely with our community, particular communities. So for this one, we're working with Project Polska to really target that that messaging within the Eastern European communities. Just to point out as well, on Fridays, you'll see on the right-hand side where it says 16 plus, we're not able to vaccinate anybody under 16 that should be in school. So that's why Fridays are 16 plus and then Saturdays and Sundays are 12 plus. This will change once we're able to offer vaccines to over 5s, and we will be changing them, but at the moment, that's who we are vaccinating. So I will stop sharing my screen. And like I say, we would love to hear how you're able to support. Unfortunately, what we're having to do at the moment is let you know as and when we're hearing about clinics. So you won't get them in a bulk like that, which is listing all of them. We're trying to get what we can, but it might be that you hear about things as and when they're happening. But I shall pause there, and then if you've got any questions, I'll come to you. And I know there's been some in the chat. So thank you. I believe we've got a hand raised. Basker. Hello, if you'd like to.
Hello, yes, hi. So, yes, you just mentioned that after having the vaccination, there's no 15-minute waiting time, but is it safe to drive straight away?
So I'm not able to comment on that because we're not clinicians, but yes, they've done a full risk assessment on this, and it is no longer required. So what we'll do outside of the meeting, I can get you some more information about that and why that is. I think that would be good to do. But yeah, we're not clinicians, so we're not able to answer that ourselves.
No, thank you very much.
Okay, thank you. Does anybody else have any other questions? I know there's been lots of chat in the just got to go back and just read. So there's saying here that there's from Bev that she's surprised to see a poor response in Loughborough. There's definitely pockets in Loughborough. So what we've been doing when we're contacting the fire service is we're really looking at certain areas that we know is low uptake. We can't do it by street, unfortunately. We just don't have that level of data, but there is certain areas that we know is a low response. So that will be where the postcards are going. This doesn't take away from the sort of behaviour change work that we need to do around certain communities or groups of people. And it doesn't answer the question about anyone that might be anti-vax. This is not really something that we're targeting. This is really about people that have got access issues, that they want a clinic that's closer to them, and it will be supplemented with other work. But yeah, there's certainly pockets in Loughborough. Karen is saying that she's had 3 doses and a 4th, which is great to hear. Yes, they can. So yeah, they can offer you anything if you're eligible at the time. So of course there is certain gaps that needs to take place between your doses, and that does vary. But again, they can check that on site if you walk in.
Thank you. I can speak, but you can't see me.
Oh, sorry,
yeah, thank you. It's just that I've never seen anywhere anybody mention about 4th doses. I know I was eligible for mine at the beginning of January. I think there must be quite a few being done now, but yeah, thank you. And I have a friend who I know is due to have her first dose anytime from, I think, Tuesday next week. Hence my question, can she just turn up? But she has had a letter. So you think if she just takes it with her?
Right, okay, sorry, I've just misread that, thinking you meant 3rd. Again, I'm going to get some clarification on that, because at the moment we're only offering 3rd.
Right.
But I will check, because I know that with 3rd vaccine, which is not booster, that is with the relevant paperwork. So I'll just get some clarity so that I've got the right words on that.
Yeah, I did through the PPG involvement. Somebody said, just go along, Karen, with all your information, and we'll sort it out when you get here. And they did. And they also said, although this vaccination centre's closed now, but they also said that I was the 3rd person they'd had in that week. So it is getting through there. So, but some guidance for some people might help if you've got any influence in that department, Jo. Thank you.
I mean, if I could also mention that all of these things is very much nationally led, so we have to wait for the Department of Health and government to instruct each local area in terms of, right, this is the push now, this is the push. So we're very much led by that national guidance as well.
That makes sense, that they're concentrating on first, second, third and third or booster doses as well. So yeah, you're right. So it does make sense.
Yeah, we'll get some clarification on that though, because it'd be useful to know, definitely. Edward's saying about if we've had, once we've had jabs or boosters, we're still getting NHS texts. Yeah, I mean, I'm still getting those, but they're done nationally, and that's why that is happening. So that's not in our control, unfortunately. That's not done by us. Yeah, it is frustrating, but
I mean, unfortunately, there is a bit of a time lag between data collected at a very local level getting up the chain to a national level. I know it's frustrating because you think, an organisation the size of the NHS, you think that that would be kind of instant, but unfortunately it isn't, because it has to be driven through the system.
Yeah, thank you. There's lots of talk about the university and people having jabs at home, and that is correct, and we're not able to get that data, so we are mindful that some people have had the vaccination at home, and again it's that lag. But yeah, the clinics that we're putting up at the universities are open to anybody. They're just the locations where we've found places to put them, and we are targeting students as well that haven't had their vaccines, and of course rightly so. So there's comments about hearing about things really late, and it will be unfortunately the first time you've heard of it, because that's the situation we're in. We're trying to speed up ways so that we hear in advance, so that you will have enough notice. So but now that I'm telling you now, I think going forward you'll hear about them a lot quicker than it being this late in the day, really. Howard, did you want to come in?
Yeah, it's just an observation. I happened to be up the Beaumont Leys shopping centre when they got the mobile clinic parked up there, but there was no advertising around the shopping centre. So if people, I came up on public transport, but I think if you come up by car, you probably wouldn't have even seen it, and you could have walked all around that place and not known it was there. Similarly, the other one they have at the High Cross, that seems to be there every weekend, again, there is no mention of it anywhere in that whole shopping centre. That is a vaccination centre in the Lower Mall, near the Galaxy Gate, near the Clock Tower entrance. So,
Howard, what was the first one that you just mentioned then, did you say?
The Beaumont Leys.
Yeah, so that was the first one that they did. It came very late in the day to us, and we picked that up as an action to say that it wasn't signposted. We are really limited what signposting we can do, but that's something that we're trying to address at the moment. So, and you make a very valid point, absolutely. It's, we need to get and what we're doing now is we're using staff to do that signposting physically. Again, this week it's really tricky. Next week we've got more of a focus on that, because it's been really hard to mobilise teams to do that because of the late notice. But yeah, you should see an improvement with that.
Jo, just to say that at Beaumont Leys, we did have staff there on the Friday and the Saturday talking to patients and telling them where the site was. And we've been out around Beaumont Leys with leaflet drops and posters in the local community in all the shops.
Yeah, thank you. And Alan is saying about we need to know at least 1 week in advance. Again, same as I've said before, we're really trying to get this now, which is why we've just put 2 on there that have been confirmed as of yesterday. Again, it's already a week. So as soon as we get them, we'll get to you. We are kind of battling that at the moment to try and get them as early as we can. Alan, did you want to come in?
Yes, something totally off piece, but I think it's really important. As you all know, Plan B restrictions have been taken off as of today. in all healthcare settings, which includes hospitals, GPs, surgeries, etc., they have insisted that mask wearing carries on until the end of March. Yourselves need to publicise this on local radio and local press, because I've seen nothing anywhere. So you will have patients going to surgeries and other places saying, but it's all finished today, when, for instance, I know our surgeries had a letter to say it's continued to the end of March. So the CCG needs to publicise this.
That's really useful feedback, Alan. It's the dilemma that we had last year as well. While society is getting back to normal, the NHS, because it is the NHS, along with public health, it does have other constraints on them because they're dealing with sick people and sometimes very, very sick and vulnerable people. So it's a good point, and we can have a chat with our communications colleagues to see what we can do around that to support practices in particular.
I think it is really important, Sue, because there's enough stroppy people around when people are asked to wear a mask in various other places. So I think unless something's done fairly quickly, there's going to be a lot of problems with it.
Yeah, I mean, that's really useful. Thank you for that. And thanks for all the other comments that we're doing. I mean, it's quite interesting, really, because in terms of the work that we're doing now, we are in that stage where we are working on diminishing returns on stuff, because we're actually trying to reach much smaller numbers of people. This is not mass communications, it's much smaller groups of people, and we're almost, you know, down to street level and door knocking. So you know, we're seeing lower numbers of going through, but the reason is it's those people, as Joe said, who are not anti-vax but have been vaccination hesitant, sometimes through just general apathy, or life has got in the way. So, you know, that plea out to you, because you are at that grassroots level, would be really beneficial to us, because we are, you know, when you get to the last 10%, 10 to 15%, then it's much smaller numbers and it's very hard to get to the right people. So
we overran a bit and there's still hands up, so I don't know if people can put things in the chat.
I just had one last comment based on what Alan mentioned. Just thinking about, you know, NHS having its own sort of communication to their patients, saying that obviously we in the NHS and in the hospitals we would still need patients to wear masks, etc. Isn't there a way that this communication can be added on to what the government says? So although the government says, you know, you can stop wearing masks everywhere apart from the NHS, because at least in that way it will stop people from saying, well, the government said this and the government said that, so how can you have your own rules? At least in that way it's one rule by the government, and it's also supporting the NHS as well.
It's a good point, and we can certainly feed that up the line, because through various meetings we are talking to both the regional and national team. We can certainly feed that up the line and just see what reaction we get. So I'm just very conscious of time because we've run over, and I was really keen, just under any other business, before I come to you, to see if there are any other discussions, to pick up the sad news around Margaret Taylor. I'm not sure how many of you knew Margaret. Probably a lot of the people in West Leicestershire CCG knew Margaret. She was a local minister in Loughborough, and she was an extremely active member of the PPG in terms of Dr. Clay's cottage surgery in Woodhouse Eaves, and it was really sad news to hear about her death. She was also an Alliance member, and her sheer determination and sheer passion, and I know you share a lot of this, but her determination and passion for patient involvement from the very first moment I met her some years ago came across so loud and strong, and she was there first and foremost for patients to make sure that their voice was heard. All involved in some of the stuff that we did in terms of West Leicestershire. I can remember in January you used to do the New Year, New You, and she was there, rain or snow or cold, really talking with patients about self-care and help, and she is going to be sadly missed. So I just really wanted to pay that a tribute to Margaret, and to give our wishes and our sadness really to her family. It's a great loss, not only to her family but to her friends and PPG colleagues. So and I'm sure that you share that. Bev, you're on mute.
Going back, but I couldn't get the question before. We're talking about all this network working. What has happened to this citizens panel that we were supposed to put on? I was put on a citizens panel. I've heard nothing for ages.
Oh, right. Okay. So the citizens panel is still active. I will just check your status on there, because you should have, just before Christmas, we had our last newsletter going out. We haven't had a survey in January, but there will be a couple of surveys that we're launching at the beginning of February. I will just check your status, Bev, just to make sure, because we have been routinely sending information out.
Oh, well, I haven't had it, I don't think.
Okay,
Oh, no.
no problem. I'll put that as a note to check that.
Okay.
So is there any other business from anyone else at all?
Just from my end, Sue, just wanted to let everyone know that I won't be able to join the next meeting, and probably a couple of other meetings, because my due date is nearing now, and I will be off on maternity after the 14th. So probably after a month or two, I'll be able to join all the other meetings. So apologies for that.
No, please don't apologise, and I'm sure I'm joined by other people on the call to wish you good luck. Yes.
Good luck.
And we look forward to you joining back again with happy news and sharing your news with us.
Yes, no, definitely will do. Thank you so much.
Okay, thanks.
Sorry.
So Bev, is that a legacy hand, or did you want to?
Right, yes.
So what we've got up there are just the next 4 meetings, but I'd just like to sort of acknowledge everybody's conversations in the chat. So we will now pull together this sort of task and finish group, really to have these more detailed discussions on the look of primary care engagement going forward. So if we just stop sharing the screen, just so I can see if there are any other last minute hands. So as always, many thanks for your support, many thanks for your input today. It's really appreciated. And we will send out the various presentations, etc., and be in touch shortly on other aspects. So thank you all very much, and enjoy the rest of your day.